to, again, it's maybe you'll be able to understand them easily. They're not too difficult, but most of the time they are available in the, again, in the books. I don't know आप लोगों ने पढ़ा हुआ है कि नहीं, but अगर पढ़ा हुआ है तो रिवीजन हो जाएगी, और अगर नहीं पढ़ा हुआ तो कोई नई बात समझ आ जाएगी. Can you see my screen?
No.
No. फिर फंस गया. अच्छा. Why this is happening today? Okay, let me check. Okay. Start sharing the window. Okay, can you see it now?
Yes, sir.
Good.
Yes, sir.
Okay, perfect. So let's start for today. Psychological theories and social perspective in etiology of schizophrenia. How many of you have read this from exam point of view? Anybody? Anyone? You can raise your hands if you don't want to talk. कोई नहीं? अच्छा, या सबने पढ़ा हुआ या किसी ने नहीं पढ़ा? So let's start then. Okay, when we talk about these, we always feel that these are old theories, which probably are, most of them are null and void. Some of them, they have still some importance in the clinical significance. But as these theories are no more practiced in clinical practice, so we don't focus on them much. But from exam point of view, historically speaking, some of these questions are relevant. If you know them, you can always relate it into clinical practice, and it is always helpful because some of these theories we still believe that there is some validity clinically, although there is no scientific data related to it, but they may have some clinical validity. So, Bismillah ar-Rahman ar-Rahim. Schizophrenia, we all know that mostly it is biological in nature, but social and psychological uh, domains, they do have a role to play in etiology of schizophrenia, propagation of schizophrenia, precipitation of schizophrenia, and maintaining factors. Lots of them are related to social and psychological aspects of the patients, right? There is one theory which we call eye movement dysfunction. So EMDR is a technique which is used in psychology to treat certain disorders. And we believe that although the evidence is not very convincing, but there are some studies available which indicates that inability to follow a moving visual target accurately is the defining basis of the disorders of smooth visual pursuit. So usually in exam, the question is, what happens in schizophrenia uh, as far as the eye movement dysfunction is concerned? And the answers could be a smooth visual pursuit is not seen, disinhibition of saccadic eye movement seen in patients with schizophrenia. Eye movement dysfunction may be a trait marker of schizophrenia. It is independent of the drug treatment and clinical state and is also seen in first degree relatives of probans with schizophrenia. Various studies have reported abnormal eye movements in 50 to 85% of patients with schizophrenia, compared about 25% in psychiatric patients without schizophrenia, and fewer than 10% in non-psychiatric ill uh, uh, control participants. Now, most of the time, again, as I said, the data is not very convincing that this could play an important part in the etiology of schizophrenia. But in schizophrenia, the smooth visual pursuit is basically a problem. and there is disinhibition of saccadic eye movements in schizophrenia. Uh, so this is one thing that is important. Then psychoneuroimmunology, again, we all know that there is decreased T cell interleukin 2 production, reduced number and responsiveness of peripheral lymphocytes, abnormal cellular and humoral activities to neurons, and presence of brain directed anti-brain antibodies. None of these are very conclusive again, but they are seen at various levels in various studies. So this has one role to play. Now, this is all biological. And we also know that there is a viral hypothesis to schizophrenia as well, in which it is said that an increased number of physical abnormalities at birth, an increased rate of pregnancy and birth complication, seasonality of birth consistent with viral infection, and geographic clusters of adult cases and seasonality of hospitalization. So this was an old concept initially back in 1940s and 50s. It was considered that the children born to mothers in winter season, when the cold was too much there, and mothers were probably having a prevalence of flu or influenza or viral infection because of this season, they may have impact on genesis of schizophrenia. Again, conclusive evidence related to it is missing. So season, winter season, geographic clusters in cold winter weathers, there is a harsh, again, weathers, and possibility of viral infection during that seasonal time could be the cause. These are some of the theories which are biological, but again, eye movement, seasonality, winter weather, viral influence, these are some of the theories, but they are not conclusive. When we come to psychological theories, so first, to begin with, every psychological theory starts with Freud because he is considered to be the Baba of psychology. And Sigmund Freud postulated that schizophrenia resulted from developmental fixations early in life. He never believed that it developed at the childbirth or at the prenatal period, but perinatal, again, not conclusive, postnatal time period in the early development was important for him. And he said that most of the people who are fixated in the developmental phase, postnatal time period, they can develop schizophrenia, which again, there are reasons to believe that. These fixations produce defects in ego development, and he postulated that such defects contributed to the symptoms of schizophrenia. So Freud believed that there is developmental fixation, ego development defects, and ego disintegration in schizophrenia, which represents a return to the time when ego was not yet developed and or had just begun to establish its early postnatal lifetime. Because the ego affects the interpretation of reality and the control of the inner drives, such as sex and aggression, these ego functions are impaired. Thus, intra-psychic conflict arising from early fixations and the ego defect, which may have resulted from poor object relations, fuel the psychotic symptoms. Now, again, this is his hypothesis that the ego disintegration is seen in schizophrenia. One, the ego developmental defects are seen in schizophrenia. Three, fixations, developmental fixations in early life are the cause of schizophrenia. Freud in 1924 proposed that schizophrenia was the result of two processes. One, regression to a pro-ego state, regression to a pro-ego state, and attempting to re-establish ego control could be another cause. He believed schizophrenia as a result of following processes. One, parents are cold, uncaring towards their child. This causes the child to regress back into the infantile state where the ego is not yet fully developed. So, the regression to a pro ego state means the child regresses back into the infantile state where the ego is not yet fully developed. And the symptoms includes delusion of grandiosity, auditory hallucinations are seen in individual attempts to re-establish ego control. So he believed that the person is trying to re-establish the ego control, and that is one of the reason of schizophrenia. Although again, there are evidence different to that. Supporting Freud in 1948, from Richmond found overprotective, rejecting, dominant, and moralistic mothers can contribute to children developing schizophrenia. Now, this is strange because most of the time, when we are meeting with the family of a person who is suffering from schizophrenia, and if you see the mothers, lots of time you will realize that these statements are probably there. So, mothers are overprotected, protecting, they reject, dominate, they are moralistic, they can contribute to children developing schizophrenia. However, again, the actual evidence is against that, but this is one of the things. So, from theory, psychoanalytical theory of developing schizophrenia is mothers. Mothers are dominating, rejecting, protective, moralistic. Then Bateson et al., Bateson or Bateson, found children who get mixed messages from their parents are more likely to develop schizophrenia. For example, if a mother was to tell her child she loved them, but looked away in disgust when the child did something wrong, the child would see this is as a mixed message. He also found prolonged exposure disrupts child internally, coherent construction of reality. So this is again, Whitson said, schizophrenogenic mother. And he felt that this double bind theory means two messages at a time. When your facial expressions are that, and you will say, I love you. So a disgust on a facial expression, but a loving message, going two messages at a time, and child get confused and he can develop schizophrenia. And again, this was back in 1956, not supported with evidence, but this is one of the theory. Altmans, Mons et al. In 1991 said that parents acted differently once their child had been labeled as schizophrenia, not prior to that. Therefore, it is not parental influence that causes the onset of disorder. Similarly, Rosenhans in 1973 found that pseudo-patient studies where nurses reacted differently to patients once they had been labeled again caused some different effects. So these theories of Bateson from which who said a dominating mother, a schizophrenic mother, and Bateson double bind theory are probably again they are weak theory. They are speculative, unfalsified, and there is lack of evidence for them. फासले कुर्ब की पहचान हुआ करते हैं, बेसबब लोग परेशान हुआ करते हैं, ये हकीकत है जहां टूट के चाहा जाए वहां बिछड़ने के इम्कान हुआ करते हैं. So again, most of the weaknesses, as I said, that is the lack of data. Now we believed in evidence-based medication, so there is lack of data. But there are definitely some other issues like ethical issues, low temporal validity, low population validity, and all of these factors make things more unscientific, which can complicate the diagnosis on this basis. Now, there is another MCQ in most of the theories of schizophrenia related to Margaret Mahler. There are distortions in the reciprocal relationship between infant and the mother. So she says that the relationship between the child and the infant, it's distorted and the relationship is reciprocal between them. So when mother is distant, the child, infant, gets himself or herself distant. The child is unable to separate from and progress beyond the closeness and complete dependence that characterize the mother-child relationship in oral phase of development. This is oral phase of the Freud. As a result, the person's identity never becomes secure. So this is a social psychological theory of Margaret Mahler. Response to reinforcements. Now, the learning theory. Paul and Lenz, 1977. If you see, most of these theories are from 1940s to 1970s. After that, things changed. Paul and Lenz in 1977 introduced the system of token economy. The token economy system of learning behavior is still very much in practice. And in most of the rehabilitation process of schizophrenia, we still try to introduce the token economy, which method is based on operant condition to reduce the bizarre motor behaviors in chronic psychiatric patients. This was a longitudinal study, so this was evidence-based. 6 years and 84 patients were assessed during structured interviews and behavioral observation. Right? So this is an important theory of token economy, which was introduced by Paul Lenz in 1977. And they say that the token economy is based on operant conditioning, which was studied actually in 84 patients over a 6 year period. Paul Fedrin hypothesized that the defect in ego functions permits intense hostility and aggression to distort the mother-infant relationship, which leads to eventual personality disorganization and vulnerability to stress. The onset of symptoms during adolescence occurs when teenagers need a strong ego to function independently, to separate from the parents, to identify tasks, to control increased risk of internal drives, and cope with intense external stimulation. In short, Paul Fedden believed that if the mother is not able to provide a good, intense relationship to the child, his ego functions are not developed properly, which leads to disintegration of personality, and it leads to some hallucination and delusional behaviors. So there is a link we try to establish between all of the previous psychological theories. These are all psychoanalytical. Harry Stack Sullivan, another question, viewed schizophrenia as disturbance in interpersonal relatedness. The patient's massive anxiety creates a sense of unrelatedness that is transformed into paratexic distortion. Now, he used the word paratexic distortion. So, this was another MCQ somewhere which I saw. Harry Stack Sullivan viewed schizophrenia due to paratexic distortion, which are usually but not always persecutory in nature. Sullivan, schizophrenia is an adaptive method used to avoid panic, terror, and disintegration of sense of self. So he believed when the person is not able to cope with the environment, he uses the methods which are adaptive in nature, and they want to remain peaceful, calm, not to worry about too many things, and then they develop schizophrenia. So avoid panic, terror, and disintegration of sense of self. The source of pathological anxiety results from cumulative experiential traumas during the development. There was some chat process going on. Everything is okay?
सर कुछ लोगों को ज्वाइन करने में इशू हो रहा है आई थिंक अगर ग्रुप बड़ा हो जाए तो बाजू का फिर स्काइप पे इशू होना शुरू हो जाता है पता नहीं मुझे लग रहा है कि ये इशू है
I really apologize for that. This was another reason why I started using Teams, but unfortunately, Teams, when we have to organize everything, and people preferred the Skype. Next time, if the group is larger, we'll definitely go for the Teams invite, which will be helpful. Anyways, coming back. So Harry Stack Sullivan again gave the theory between 1892 and 1949. So this was early 40s when he hypothesized that schizophrenia develops because of again disturbance in interpersonal relatedness, paratexic distortion, to avoid panic, terror, and disintegration of sense of self. This was his theory. Psychoanalytical theory also postulates that the various symptoms of schizophrenia have symbolic meaning for individual patients. Every patient is different, and every different individual have different perception of it. Feelings of inferiority are replaced by delusions of grandiosity and omnipotence. Hallucinations may be substitutes for a patient's inability to deal with objective reality and may represent inner wishes of fear. So, most of the delusions, psychoanalytical people believe that they want to overcome their deficiencies, so they develop it. And when they are hallucinating, actually they are trying to replace their inferiority with substitute them or replace them to deal with the actual reality. So delusions similar to hallucinations are regressive, restitutive attempts to create a new reality to express hidden fears or impulses. So, people, again, there is an example given in this photograph. This patient wore suits too large for him in the delusional belief that he would appear taller to others. Now, this is one theory. His sleeves are long, his trousers are too long, and he has folded them upwards. Now, although again this is just a way to look at it, but we know that now data is not suggestive that the hallucinations or delusions are secondary to these thought processes. Learning theory. In a study of British 4-year-old children, those who had a poor child relationship had a six-fold increase in the risk of developing schizophrenia. And offspring from schizophrenic mothers who were adopted away at birth were likely to develop the illness if they were reared in adverse circumstances compared with those raised in loving homes by stable adoptive parents. Now, the twin studies, adoptive studies, and monozygotic twins and dizygotic twins and adoption studies now all are in favor that it is not actually number of times, majority of the times, the environment, it's actually the genetic basis. But previously, this was one of the evidence that if a person is normal, he's raised by a family where schizophrenia is there, he will adopt some symptoms and develop schizophrenia. Well, he will definitely develop some symptoms, which we call the shared delusion as well, but developing a full blown schizophrenia probably is not the case. Nevertheless, no well controlled evidence indicates that a specific family pattern plays a causative role in the development of schizophrenia. Some patients with schizophrenia come from dysfunctional family, just as they do many non-psychiatric ill persons. So the evidence is lacking. Double bind theory. Uh, the double bind concept was formulated by Gregory Betson, which I mentioned earlier as well, and Donald Jackson. So again, I don't know if you'll be able to remember both the names, because Betson, if you remember his name, is enough for double bind theories. And as I mentioned, that children withdraw into psychotic state to escape the unsolvable confusion of the double messages, which is called double bind theory, right? So this was mentioned. Another MCQ is related to schisms and skewed families. This theory was given by Lidz, L-I-D-Z. Lidz given the theory of schism and skewed families. Now, what is schism and skewed family? In one family type, with a prominent schism between the parents, one parent is overly close to a child of the opposite gender. So the father probably loves more to the daughters, and the mother's loves more to the son. In another family, a skewed relationship, now this is schism, that your deviation is towards one gender. So opposite gender. So a male parent is attracted towards more towards a female child, more loving, more caring, more involved, more again helpful. In other relationship, the skewed relationship between child and one parent involves a power struggle between the parents and the resulting dominance of one parent. So both father and mother wants to take care of the child, but usually mothers over again come this they are over with this war, and they are dominating. They give messages to the children which they accept, and then they develop schizophrenia. Now these dynamics of stress and tenuous adaptive capacity of the person develop people develop schizophrenia. So Lids gave the theory of schism and skewed families. Schism, when one gender parent is attracted towards the opposite gender child, and skewed when both fight for the dominance and one parent takes the dominance and the child is confused. Now, again, this is theory, and MCQ is there sometimes related to skewed schism families by Lids, but historically, again, no evidence, no data suggestive of that. Another theory is by Lyman Wine, pseudo-mutual and pseudo-hostile families. He described that some families suppress emotional expression by consistently using pseudo-mutual and pseudo-hostile verbal communication. So they are giving, we are very loving to you, but actually their behaviors are too hostile. In such families, a unique verbal communication develops. When a child leaves home and must relate to the other person, problems may arise. The child's verbal communication may be incomprehensible to outsiders, and he develops schizophrenia. Again, not very much convincing data for it. Pseudo mutual and pseudo hostile families, concept given by Lyman Wine. Expressed emotion. Now, this is again, as token economy on the basis of the learning theory is still in practice in the rehabilitation process of schizophrenia. Similarly, the expressed emotional theory is also very much valid, and we believe that this has a lot to play, maybe in precipitation and progression of the disease, but it may not be the etiological factor for schizophrenia. So parents or other caregivers may behave with overt criticism, hostility, over involvement toward a person with schizophrenia. Many studies have indicated that the families in which high levels of expressed emotion, the relapse rate for schizophrenia is high. So it is expressed emotional theory is not actually etiological theory of schizophrenia now anymore. It plays a vital role in long-term progression and prognosis of schizophrenia. And high expressed emotions, uh, it is said that if you spend more than 40 hours with a person and you are hostile, you are critical, you are over involved, then the chances of relapses for schizophrenia is very high. The assessment of expressed emotion involves analyzing both what is said and the manner in which it is said. So sometimes people say, no, 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 we don't spend much time together, but actually they are in the house for more than 40 hours in a week. Now, these theories of schizophrenia, the psychological theories, the controlling parents, the schizophrenogenic mothers, no scientific basis. Sociological, cultural perspective, impact of stressful social situations and environmental conditions, family interaction in schizophrenia, which is again Betson's theory, double bind theory, uh, then stress and schizophrenia, a full-blown schizophrenia in response to a stressful life event. This is again not actually in practice. Family theories. Again, as I mentioned earlier, schizophrenogenic mother from is a very much there. We don't believe in it because it's not evidence based, but it has definitely. When you are sitting in a clinic, you see a person from suffering from schizophrenia, and after the person, if you have a chance of meeting the mother, you will find her to be a very schizophrenogenic, like again, uh, those characteristics that I have mentioned earlier as well. So I won't be repeating, which is these characters, so there is a repetition, was coined for mothers who are characterized as rejecting, overprotective, self sacrificing, impervious to the feelings of others, rigid and moralistic about sex, fearful of intimacy, and double bind communication again. Good. Social drift theory. This theory was given by, I think the name was Ottoman. I actually forgot the name. I was not able to find the name, but I believe that this is Ottoman's theory, Ottoman's theory, social drift theory. It says that individuals drift to the bottom of society when they have schizophrenia or mental health problem, as it takes away any status they may have. So most of the time we see that most of the people who are suffering from schizophrenia, and if they are resistant, they are chronic, their financial health is compromised, their economical health is compromised, their social health is compromised, their psychological health is compromised. So gradually they drift down to the poverty and baseline. They are usually homeless on the streets. This is called social drift theory. And this was probably given by Ottoman. Correct me if I'm wrong. Now, how this theory explains schizophrenia? When people begin to develop schizophrenia and lose touch with reality, they began to ignore society as it does not make sense to them. This means that they do not complete normal activities and may not be motivated by the rewards others are. So if I work for the whole month, I expect that by the end of the month, I will have a good amount of money as a salary to make sure that my other needs are met. But in schizophrenia, they are not bothered about it, so they develop these kind of symptoms. So ignoring society, ignoring their things they should be doing, ignoring the rewards related to, again, various kinds of the jobs, you drift down and you end up in poverty and downward spiral. Now, there is a question to this as well, and there are definitely, again, whether it is a theological factor or it is the consequence of the disease that is triggering. Uh, Lots of our poets who were actually good poets, that we recite their poems in every day-to-day practice, Bulle Shah, Farid, and people like them, they most of the time they were living in the places where they were actually not too much bothered about themselves. So they वो कहते हैं मैं की नफी की उन्होंने और मैं को मार के वो दूसरी तरफ चल पड़े. Now, if we relate this theory with them, so probably they were schizophrenia, suffering from schizophrenia. But if you look at their poetry, it has so much depth and so much meaning to it that it doesn't seem like that they were suffering from schizophrenia. So whether it's something different or whether it was something related to drift theory, I don't know. But this is always a question that always again intrigued me, and I wanted to again see what was there. Could not find evidence, much of the evidence. Another MCQ is stress diathesis model. Stress diathesis model. This is again one of the question asked in the MCQ. What is stress diathesis model? Also known as vulnerability stress model. Vulnerability stress model. Now, stress diathesis model combines both biological and ecological factors to explain the manifestations of mental disorders, especially the schizophrenia. In this model, the degree of vulnerability is given psychiatric episode is determined by each person's tolerance to traumatic, stressful life events. So if a person uh, has multiple traumatic, stressful life events, death of the parents in the early age, was not able to complete the education, was not able to again sustain a good job, was not earning good enough amount of money to sustain the good living. All of these factors, they lead to stressful states and then development of schizophrenia. But as far as the again etiology is concerned, again, evidence is not very significant. But yes, stress diathesis model in the progression, outcome, and prognosis of schizophrenia is still very much valid. कुछ बातें सुनकर लगता है हर बात को सुनना जरूरी नहीं, कुछ बातें कहकर लगता है चुप रहते तो अच्छा था, कुछ बातें सहकर लगता है कुछ कह देते तो अच्छा था. Any questions so far? Oh, you're not able to understand anything. Sorry. Okay. No questions as such, but it was just the comments. Any questions so far?
So there's a raised hand.
Yeah,
Sir,
Lare. Yes.
I wanted to ask about token economy. Can you please go over that concept again? I didn't understand that.
Okay. Token economy. Let's go back. This token economy theory was actually basis of the learning theory. So learned behaviors, operant conditioning. So usually the MCQ is related to operant conditioning. Where is that? It went away somewhere. Token economy. I missed it somewhere. Okay, let's go back. Let me explain it otherwise. If I won't be able to find the slide, I can tell you token economy. Okay, this is actually a method. So when the learning theory is based on your learning behaviors. Now, operant conditioning means instrumental learning. Instrumental learning means that we combine the unconditioned stimulus with conditioned stimulus to get the conditioned response. I don't know if I am making sense. So, when a person is having uh, he's hungry, he needs food. Like this was the most commonly example given most of the time, that if the person is hungry, he needs food. Now, if you pair it with the bell, so most of the animal studies are related to it in operant learning. If you pair it with the bell, every time you ring the bell, you serve the food. Now, you pair a conditioned stimulus with unconditioned stimulus with conditioned stimulus, and you get the conditioned response, and that is salivation. So the food is paired with the bell. When the bell rings, the food is served, the animal starts salivating, and then there is a time when you just ring the bell, an animal starts salivating because he feels that now the food will be served. This is a learning theory, operant conditioning. And if we apply this to the real life patients, we pair things like we say, okay, fine. If you'll be able to brush your teeth every day in the morning, by the end of the seventh day, your brushing is regular, you will get 7 stars, and by getting 7 stars, you will be given one Pepsi and a sandwich or a burger of your choice, or a pizza, or maybe you can go out for a walk, or maybe you any reward which the person likes, of course, his of his interest, not something that you feel appropriate, but something which he desires. So in schizophrenia nowadays, these token economy principle operant conditioning is used, that we try to give them the rewards in the form of stars. Collecting this number of the stars will give you this much benefits. So that it's a kind of a motivation to keep on doing things. So you mix conditioned stimulus with unconditioned stimulus to get the conditioned response, which is brushing the teeth every day. समझ आई? Lare,
Ji, sir. Thank you so much. Got it.
you got the point? It's basically based on learning theory. operant conditioning. The token economy was the concept to get the desired outcomes in the rehabilitation of schizophrenia, and this is still used. It has nothing to do with the etiology of schizophrenia, but it has a lot to do with the outcome and prognosis and the rehabilitative process. Any other question? That's it. I apologize. I was not able to actually present this. I would have given this presentation on Friday because that day I have more time and could have explained more related to these theories. So I was a bit in a rush as well. But unfortunately, what happened was that I prepared the slides and I was not able to save them. So I lost all the slides just before the Friday. So I was confused what to do. So I was not able to present. So I made it again, although this was not as good as the one I prepared earlier. So I missed it. On Friday, we will talk about the management of conversion and dissociative disorders. This was another topic which was asked by one of the residents. So, how actually clinically, ideally, we should be managing patients with conversion disorders? Most of the time in our wards, we see lots of conversion patients. They are lying down in the beds, five female patients, and all of them are having conversion disorders, different etiology, but the management stays the same. So, what should be the ideal management? Coming Friday, we will try to cover that, right? Any other question? Most welcome to ask. Otherwise, we'll meet on Friday. Anybody, any question? Nothing? Sure? Okay.